Hi, my name is David, and I'm going to be posting some videos out here because I was diagnosed on June 1st with melanoma cancer. And essentially, I just want to share what I've learned about this process, share my experience, share as many facts and things to think about that I can with all of you if you might be in a similar situation or know somebody who is. At this point right now, I am beyond all the surgical processes, and I'll talk about that in a little bit. And I've actually just begun my interferon treatments, which is a standard of care for melanoma cancer. But I'm going to break these videos out into segments. So the first few, I'll do here tonight. And the first one I'm going to talk about today, right now, is just the original diagnosis and just a history around that. Then I'll talk a little bit about the first surgery to remove the rest of the cancer and do a lymph node biopsy. And then I'll also talk about the lymph node dissection. And lastly, my first interferon treatment. So for part one here, I want to just talk a little bit about the initial diagnosis. Like I said, that happened on June 1st of 2012 this year, and it was quite a shock. It turns out that a mole that I had had for 15 years probably on my upper thigh became cancerous. So I guess the first thing I'd note to you is that, and I guess this is more important for those who haven't been diagnosed with melanoma at this point, get those things checked out. I thought mistakenly that if I had a mole for 15 years, it obviously wasn't cancer, I'd be dead by now. But cancer starts in these things, and it can start at any time. And obviously, in my case, it started a long time after I originally had the mole. The mole had many of the signs, if you're familiar with the ABCDs, E's. It had many. It was asymmetric. It was multicolored. It had, not clear margin or boundaries and that kind of thing. But it had had that for a long time. What happened this year, that it started to change more rapidly, is it got elevation, it grew depth on the surface of the skin, whereas it was always flat before. So anyway, I went to the dermatologist, schedule early, because at least in Cincinnati, it's very hard to see a dermatologist. I had to wait almost 3 months, or 2 months, 2 to 3 months, and it's obviously not something you want to do if you're concerned about that. And so he took it off. He called me back a week later, said I had melanoma. And there were a couple of other facts that he gave me, and these are things that you want to look for or ask about. So the first is the depth into the skin. Mine was 1.9 millimeters. Less than 1 is considered small. More than 4 is considered large. So it's kind of in the middle section. But it's certainly, if it's over 1, there's cause for concern, because it might, at that point have had time to spread to your lymph node. So that's the first thing, is kind of that depth into the tissue. Another one is the mitosis rate. And I don't know all the details around this. Mine was less than 1, which was small, but I don't know what other valid values are. But you'll want to ask about that. It essentially indicates how quickly the cancer cells are replicating themselves. Obviously, less replication is good, so less than 1 in my case was a good thing. Another thing you want to ask about or understand is whether or not it's ulcerated. And in my case, it was not ulcerated, so again, another good sign for me. The staging on mine after the first initial diagnosis and the facts that I just gave you was 1B. Stage 1, just because we only knew that was in the skin. B, because it had gone more than 1 millimeter. But it was not stage 2 because it was not ulcerated, and there's some other things to think about there. But so I was at stage 1B at this point. So beyond that, then, once you know that it's cancerous, the next step is to get more of the tissue around the mole removed. It's a surgical procedure. At the same time, they will also remove a lymph node or 2 in that area. And I'm going to talk about that in the next video.